finally back in the middle of the action. Football fans from across Europe are coming together. The beer is flowing, and all of it is happening without face masks, as if nothing ever happened.
We are worried about the Delta variant.
The Delta variant means we have to stay cautious.
The Delta variant is coming. It spreads faster than previous variants.
So is the party over? Should Europe be back on a crisis footing? Is the vaccine rollout not fast enough? What's the verdict for Europe? Is the glass half empty or half full? Hello and welcome to DW's COVID-19 special. I'm Daniel Winter in Berlin. Delta, Delta Plus, even a Gamma, a veritable alphabet soup of coronavirus variants. Let's take a closer look at Delta, which originated in India. It spreads faster than the original. In Europe, it's becoming the predominant strain. Delta accounts for 97% of all sequenced positive test samples in the UK and is blamed for sending infections rising once again. It's also dominant in Portugal and Russia. Elsewhere, the variant is spreading quickly in Austria, where it represents 1 of every 2 cases, and it's getting a foothold in the Czech Republic too. In Germany, recent data shows Delta is around 37% of new infections, but the country's infectious disease centre recently estimated it was already higher, perhaps 50%. Some predict the Delta variant could account for 90% of all new cases by the end of August. That may sound bad, but remember, there's no evidence that the disease is any more dangerous. The scientific evidence shows the spread of Delta is cause for caution, but not for panic.
Getting the first shot of a vaccine against COVID-19 is likely to come as a big relief to those lucky enough to have one. But what happens when new variants come along? The world of science has some good news on this front. Against the Delta variant, BioNTech was found to be 88% effective at preventing symptomatic disease. That's according to a study by Public Health England. AstraZeneca was 60% effective. As for the Delta Plus variant, not enough data is available to know how it interacts with immunisations. Scientists in India and worldwide are looking into it. But researchers say it's unlikely it'll outfox the current jabs. As well as the vaccine's effectiveness against the variants, another big question is how long the shots protect us for. According to a Nature paper, it could be a good while. That's for mRNA jabs like BioNTech and Moderna. The vigour of the immune response found in some BioNTech-vaccinated people was said by researchers to be a strong indication that protection could last for years. That's against COVID-19 as it looks at the moment. If the virus changes out of all recognition, it might be a different ballgame. But that may or may not happen in the future. For now, the vaccines available are our best way out of this pandemic.
And joining us now is Dr. Andreas Bergthaler, a virologist at the Austrian Academy of Sciences. So, Alpha, Beta, Gamma, Epsilon, Delta and Delta Plus even now. How worried do we need to be about all these variants?
I don't know whether worried is the right word. I would say we have to be alert because we know that the virus keeps changing. This is something we have been observing since the beginning of the pandemic. And we do know that there are certain variants which have become more infectious, sometimes also acquiring immune escape properties, so evading the immune response a bit better. And these are all properties that one has to factor in when we try to counter the virus by, for example, particular measurements such as social distancing or vaccination.
And why is it that we're now suddenly hearing about so many variants showing up? Are they really just coming to light just now, or are we just starting to understand them more? What's the case there?
I think it's a very interesting question that science itself and the scientists, I think, don't fully understand yet. What is clear is that many of these variants, they actually take quite some time until they surface. So just to give you one example, Delta has been first sequenced in September 2020. So it took more than half a year for this virus to eventually hit the UK and eventually now also rest of continental Europe and the world. And so this is one thing. It takes time for these variants. At the same time, also, we have evidence that we see over the last months that evolution might be accelerating, so that somehow SARS-CoV-2 might be faster in acquiring mutations. And these are all processes that scientists try to understand better.
Okay, and looking at what the possible near future could be dealing with all of these variants, the UK says that they're aiming for total unlocking on June the 19th, but Delta case numbers are still very high. So is this the right thing to do, in your opinion? Now, do we just have to accept that there is going to be no good time to unlock and just grit our teeth and get through it?
I mean, to cite some well-known scientists in the UK, this is going to be a big experiment. And it's always, I think, difficult or impossible to know upfront what's going to happen. But I think chances are that this will lead to a big spike and increase of infections. And the question is, how much will this affect hospitalization rate and severe cases of clinical disease? And we do know that in general, the current vaccines, including AstraZeneca that is used widely in the UK, but also BioNTech, for example, has a very high protection against severe disease. And this is something I think that one has to see, since there's still quite a big share of the population, including the younger ones, that have been not vaccinated, whether this experiment turns out to be the right way.
Right, well, I'd just like to pick up on that, actually. You know, Israeli researchers just recently have said that the BioNTech jab is less effective against the Delta variant than previously thought, which is what I guess you were referring to there. What does this mean for the fight against COVID-19?
I think one has to distinguish between the different effects of being vaccinated. On the one hand, a vaccine is there to protect yourself. So it's kind of an egoistic action. And this is still giving you a very high protection against the Delta variant. The other point is you would like to have a vaccine to prevent the spread of the virus, so from being infected in the first place and then transmitting the virus to other persons. And there seems to be some data coming from Israel that maybe those people who have been vaccinated with BioNTech quite some time ago already, so, and this is also important to factor in time, right, that those people might still get infected, although they don't succumb to the disease or develop severe disease. So I think overall, there's still good news that the vaccines are working against Delta, yes, but it could be that they're not as effective anymore in reducing the spread.
So are we kind of wasting our time with too much alarmism around the variants? No, I'm not sure. I think we should not be surprised anymore after 1.5 years of the pandemic that there will be new variants coming around. And whether it's Delta, Epsilon, Lambda, the Greek alphabet has 24 letters, so let's see when we reach Omega. But I think these are things that we can expect. The big question with all of these new arriving variants is, do they have changed properties? Are they more infectious? Do they lead to more disease? Right. Are they potentially escaping the immune response, be this from natural infection or also from vaccination? Okay. And this is something, I guess, that has to be assessed for each and every variant. Absolutely. Important questions for the future for us to ask there. Dr. Andreas Bergthaler of the Austrian Academy of Sciences. Thank you very much for joining us.
Thank you for having me.
And it's not just us who ask the questions now, it's your turn. It's the part of the programme where we put one of your questions to our science correspondent, Derrick Williams.
Does the vaccine block the virus or simply keep it from causing severe disease?
Okay, I've talked about this several times in the past, but maybe it's time for an update on what we know now. As you rightly point out, Mark, initial trials carried out with vaccines that have been approved for use so far, they were set up to look at the vaccine's safety and how well the vaccines were able to block the development of symptomatic disease in recipients, in particular severe disease. And they're really, really good at that, though they're not perfect. What are called breakthrough cases do occur. Those are people who are fully vaccinated that somehow subsequently test positive for the virus. But when you look at the numbers, breakthrough infections are few and far between, and most of the people it happens to get asymptomatic or mild cases of COVID-19. Breakthrough cases that end up in the hospital are even fewer and far betweener, if you can say that. So a big win on the primary goal of stopping bad disease. But it's taken time to gather data on a major secondary goal, which is stopping virus transmission. Do vaccines also provide at least some degree of what's called sterilizing immunity? That's when, if you're exposed to a pathogen after getting your shots, your immune system is so primed to wipe it out that the pathogen basically has no chance to gain even a temporary foothold. And since it can't replicate in you, you can't give it to someone else. Evidence is now piling up that if you're vaccinated, then your risk of catching COVID-19 in a measurable way is a lot lower. So the logical assumption is that the chances you might subsequently pass it along are also a lot lower than they would be for someone who is unvaccinated. But a small chance isn't a zero chance. The fact page at Johns Hopkins University expresses our current level of knowledge very well, I think. It says vaccines are likely to reduce the risk of virus transmission, but probably not completely for everyone.
And that's all for this edition of our COVID-19 special. For more information about the pandemic, you can check out the COVID-19 section on our website, dw.com. I'm Daniel Winter in Berlin. Until next time, thanks for watching and take care.